Mestrolone, sold under the brand name Proviron among others, is an androgen and anabolic steroid AAS medication which is used mainly in the treatment of low testosterone levels. It has also been used to treat male infertility, although this use is controversial. It is taken by mouth. Side effects of mestrolone include symptoms of masculinization like acne, increased hair growth, voice changes, and increased sexual desire. It has no risk of liver damage. The drug is a synthetic androgen and anabolic steroid and hence is an agonist of the androgen receptor, R, the biological target of androgens like testosterone and dihydrotestosterone, DHT. It has strong androgenic effects and weak anabolic effects, which make it useful for producing masculinization. The drug has no estrogenic effects. Mestrolone was discovered and introduced for medical use in 1934. In addition to its medical use, mestrolone has been used to improve physique and performance, although it is not commonly used for such purposes due to its weak anabolic effects. The drug is a controlled substance in many countries and so non-medical use is generally illicit. Medical uses. Mestrolone is used in the treatment of androgen deficiency in male hypogonadism, anemia, and to support male fertility among other indications. It has also been used to treat delayed puberty in boys. Because it lacks estrogenic effects, mestrolone may be indicated for treating cases of androgen deficiency in which breast tenderness or gynecomastia is also present. The drug is described as a relatively weak androgen with partial activity and is rarely used for the purpose of androgen replacement therapy, but is still widely used in medicine. Non-medical uses. Mestrolone has been used for physique and performance-enhancing purposes by competitive athletes, bodybuilders, and powerlifters. Side effects. Side effects of mestrolone include virilization among others. Pharmacology. Pharmacodynamics. Like other AAS, mestrolone is an agonist of the androgen receptor, R. It is not a substrate for 5-alpha reductase, as it is already 5-alpha reduced, and hence is not potentiated in so-called androgenic tissues such as the skin, hair follicles, and prostate gland. Mestrolone is described as a very poor anabolic agent due to inactivation by 3-alpha-hydroxysteroid dehydrogenase 3-alpha-HSD in skeletal muscle tissue, similarly to DHT and mestanolone 17-alpha-methyl-DHT. In contrast, testosterone is a very poor substrate for 3-alpha-HSD, and so is not similarly inactivated in skeletal muscle. Because of its lack of potentiation by 5-alpha reductase in androgenic tissues and its inactivation by 3-alpha-HSD in skeletal muscle, mestrolone is relatively low in both its androgenic potency and its anabolic potency. However, it does still show a greater ratio of anabolic activity to androgenic activity relative to testosterone. Mestrolone is not a substrate for aromatase, and so cannot be converted into an estrogen. As such, it has no propensity for producing estrogenic side effects such as gynecomastia and fluid retention. It also has no progestogenic activity. Because mestrolone is not 17-alpha alkylated, it has little or no potential for hepatotoxicity. However, its risk of deleterious effects on the cardiovascular system is comparable to that of several other oral AAS. Pharmacokinetics. The C1-alpha-methyl group of mestrolone inhibits its hepatic metabolism and thereby confers significant oral activity, although its oral bioavailability is still much lower than that of 17-alpha alkylated AAS. In any case, mestrolone is one of the few non-17-alpha alkylated AAS that is active with oral ingestion. Uniquely among AAS, mestrolone has very high affinity for human serum sex hormone binding globulin (SHBG), about 440% that of DHT in one study and 82% of that of DHT in another study. As a result, it may displace endogenous testosterone from SHBG and thereby increase free testosterone concentrations, which may in part be involved in its effects. Chemistry. Mestrolone, also known as 1-alpha-methyl-4, 5-alpha-dihydrotestosterone, 1-alpha-methyl-DHT, or as 1-alpha-methyl-5-alpha-androsten-17-beta-OL-31, is a synthetic androstane steroid and derivative of DHT. It is specifically DHT with a methyl group at the C1-alpha position. Closely related AAS include metenolone and its esters metenolone acetate and metenolone enanthate. The antiandrogen rosterolone 17-alpha-propylmesterolone is also closely related to mestrolone. History. Mestrolone was synthesized and introduced for medical use in 1934 and was the first AAS to be marketed. It was followed by methyltestosterone in 1936 and testosterone propionate in 1937. The drug continues to be widely available and used today. Society and culture. Generic names. Mestrolone is the generic name of the drug and its INN, USAN, BAN, and DCIT, while mestirolone is its DCF. Brand names. Mestrolone is marketed mainly under the brand name Proviron. Availability. Mestrolone is available widely throughout the world, including in the United Kingdom, Australia, and South Africa, as well as many non-English-speaking countries. It is not available in the United States, Canada, or New Zealand. The drug has never been marketed in the United States. Legal status. Mestrolone, along with other AAS, is a Schedule III controlled substance in the United States under the Controlled Substances Act and a Schedule IV controlled substance in Canada under the Controlled Drugs and Substances Act. Research. In one small-scale clinical trial of depressed patients, an improvement of symptoms which included anxiety, lack of drive and desire was observed. In patients with dysthymia, unipolar, and bipolar depression significant improvement was observed. In this series of studies, mestrolone led to a significant decrease in luteinizing hormone and testosterone levels. In another study, 100 mg mestrolone cypionate was administered twice monthly. With regards to plasma testosterone levels, there was no difference between the treated versus untreated group, and baseline luteinizing hormone levels were minimally affected. References. External links. Proviron, Mestrolone, William Llewellyn's Anabolic.org. Further reading. Morrison, Mary Chase, 2000. Hormones, Gender and the Aging Brain, The Endocrine Basis of Geriatric Psychiatry. Cambridge, UK, Cambridge University Press. p. 134. ISBN 0-521-65304-5.